why if we have the hemoglobin values of two pregnant ladies, say one with the value of 9 milligram per deciliter hemoglobin and the other one with 12 milligram per deciliter, we want to know whether they are anemic, and if they are anemic, what are the consequences of anemia in pregnancy. We would also like to know a bit about anemia and its clinical features, its types, its treatment according to Ayurveda. So that is a topic for discussion, and today we'll talk about anemia a bit in detail. So coming to the case, the lady with the 9 milligram per deciliter is definitely anemic, and the other lady with 12 milligram per deciliter isn't, because the normal value of hemoglobin in a pregnant lady is 11 milligram per deciliter. This is the minimum value. So coming to the definition of anemia, anemia is a condition that is characterized with low hematocrit as well as low hemoglobin values. And hematocrit value in a male, the range is from 40 to 55%, and in females it is from 35 to 45%. With regards to hemoglobin, in males the value is, the range is from 13 to 18 milligram per deciliter. In females it is from 11.5 to 16.5 milligram per deciliter. And in young children, that is from 6 months to 6 years, it is 11 milligram per deciliter, and from 6 years to 12 years, it is 12 milligram per deciliter. So these are lab values. There can be slight variations. This is the general value. Now into the consequences of anemia in pregnancy. Anemia in pregnancy is a serious issue, because the pregnant lady is likely to deliver preterm babies as well as babies with low birth weight. The normal birth weight of a baby is 2.5 kilograms, and less than that is called low birth weight. Low birth weight is an invitation to an array of infections, so that has to be prevented, and for that the first step is to check anemia in pregnant ladies. Now coming to the clinical features of anemia. For that we have to know what this hemoglobin is all about. Hemoglobin is a pigment that gives red color to blood. It carries oxygen throughout the body. So that means when the hemoglobin values are less in the body, the oxygen supply to the body is less. That means that there is a breathlessness or dyspnea on exertion, and there is a fatigue, weakness and giddiness, and also there is a loss of appetite and sleeplessness, especially while retiring to bed at night. There is severe pain in the legs and difficulty in sleeping. Now coming to the physical examination, we said that hemoglobin gives a red color to blood. So when the hemoglobin levels are reduced in the blood, we cannot see that red color, and it is visible in the conjunctiva. If we pull the lower eyelid a bit, we can see that paleness, and paleness is also visible on tongue as well as on nail beds. So this is about anemia in general, and we'll talk about the different types of anemia, especially iron deficiency anemia, vitamin B12, folate deficiency anemia, as well as hemolytic anemias in the coming sessions. Thank you.